We're pleased to be joined now by Dr. Mark Okusa, ASN's president, and also Tod Ibrahim, ASN's executive vice president, here as we start Kidney Week 2018. Welcome to both of you.
Well, thank you for having us, and thank you for interviewing us.
Well, we want to begin with you, Dr. Okusa. You're wrapping up your term this year. Take us back and share some of the highlights from the year and some of the accomplishments that you're most proud of.
Well, thank you. Well, it's been a wonderful year. It's been exciting, and as president, I've learned a lot about the organization, and we've accomplished several things that I think I'm very proud of. The first is that we've collaborated with international societies, such as the International Society of Nephrology and the ERA-EDTA, and we've collaborated on trying to determine the burden of kidney disease worldwide. We determined that there are 850 million people in this world that have kidney disease. And this is important because it reflects on the fact that it's 20 times more than patients who have cancer, 20 times more than patients who have HIV or AIDS, and twice the number of patients who have diabetes. And it's important for us because this allows us to advocate for patients with kidney disease so that we can raise additional funds and research dollars in order to make new discoveries to impact the lives of patients with kidney diseases. So the second area that I want to discuss is the Kidney X. This is going to be launched on Thursday, and we're very excited about this because it's a public-private partnership between Health and Human Services and the American Society of Nephrology. And it's aimed to accelerate breakthroughs in therapeutics to help our patients with kidney disease. And the beauty of this is that it's all under the umbrella of Health and Human Services, which incorporates the FDA, NIH, and CMS, which allows seamless integration and development of a discovery into the commercial space.
Let's talk about current affairs now with ASN. Tod, tell us about some things that are currently underway with ASN.
Well, as Dr. Okusa mentioned, we're very excited about Kidney X, and as that is launched on Thursday, I think we'll be looking to do other activities related to research, discovery, and innovation. So ASN has a large commitment to the next generation of nephrologists, researchers, and other scientists and health professionals through our ASN Foundation for Kidney Research. So it's about a $4 million a year commitment, so we're excited about that. We're also excited about the activities around launching a new journal. So Kidney 360 will be an online-only open access journal that we'll be launching soon. And then finally, we're in the process of really looking at all of our educational programs and making sure that we can help nephrologists maintain their career excellence. And so really continuing to improve the strength of ASN, which is our commitment to education across each nephrologist's career.
This week, I know, is a big week, and on Thursday, you'll be giving your address, your presidential address. What will you be focusing on there? I'm sure some of the things you already mentioned.
Well, yes, I will be talking about some of those things, but in addition, my real mission and my goal on Thursday is to inspire nephrologists and inspire those in attendance. They include trainees who are medical students, who are residents, who are fellows. In addition, there are other health professionals who will be there. And so what I'd like to do is send them a message that nephrology is terrific, it's exciting, and that we're on the verge of major discoveries, and we are pushing the envelope with regards to innovation. And so hopefully this message will get out to them, and they'll be excited about nephrology.
I know you're looking into the future in many ways, like you said there. Tod, tell us about the vision for the next few years for ASN.
So I would start with, if you look at our strategic plan, our fifth goal is to reassert the value of nephrology. Unfortunately, nephrology is currently undervalued in a lot of health systems. And so not only through research, innovation, and discovery, and thinking through ways that we can accelerate therapies for the 850 million people worldwide with kidney diseases, we can look at how care is delivered and other ways that the nephrologist role can become even more valuable, which will make it a more appealing specialty moving forward. Another thing that we're excited about for next year is really taking a hard look at what we do in the public policy arena and continuing to develop our relationships both with the Department of Health and Human Services through Kidney X, the Food and Drug Administration through our Kidney Health Initiative partnership, and with the Centers for Disease Control and Prevention related to the nephrologist transforming dialysis safety. So you put this all together, and we're valuing the nephrologist and his or her role in the health system. We're looking at the future in terms of discovery, which will benefit patients, but then we're also really focused on ways to improve care now, if that's through eliminating preventable infections in dialysis units, or through the Kidney Health Initiative accelerating the process for having drugs approved.
I know there'll be thousands of people here this week for Kidney Week 2018. Anything else you think some of the attendees need to know about this week or about ASN in general?
Yes, Kidney Week is probably the best and the largest kidney meeting in the world. There's going to be probably close to 13,000 members in attendance, and in addition, they're from about 130 different countries. They consist of nephrologists, physicians, scientists, advanced practitioners, and other health professionals who will be in attendance. It has a balance of basic science. It has a balance of clinical science, translational science, and basically something there for everybody. And so it's a meeting where students will enjoy, and a meeting where a nephrologist and clinicians will enjoy as well. The plenary sessions are going to be very exciting, and we have world-class speakers, a former Nobel laureate. We have a former commissioner for the FDA. We have the director of NIDDK there. So they will be giving terrific talks, and we're very excited about that.
Todd, anything you want to add to that?
Well, I don't just welcome everyone to San Diego and to ASN Kidney Week 2018, and I hope everyone has a chance to enjoy one of the most beautiful cities in the United States.
All right, Tod Ibrahim and Dr. Mark Okusa, we thank you for giving us some time to let everybody know about the upcoming week and what's going on at ASN.
Thank you.
Thank you.
ASNTV has all the coverage you want from this year's conference. Be sure to check out all of the content, which is updated every day here on YouTube during Kidney Week 2018.